Question number 1. Which nursing principle focuses on respecting the patient's right to make their own decision? The correct answer is option B, veracity. Question number 2. What electrolyte imbalance most commonly leads to dangerous cardiac dysrhythmias? The correct answer is option B, hypokalemia. Question number 3. Which assessment finding indicates early hypoxia in a patient? The correct answer is option B, restlessness. Question number 4. What action should the nurse take when a patient with chest pain becomes unresponsive? The correct answer is option A, check for breathing and pulse. Question number 5. Which vital sign change is an early indicator of shock? The correct answer is option B, increased heart rate. Question number 6. Which precaution is most important when caring for a patient with tuberculosis? The correct answer is option D, airborne precautions. Question number 7. What lab value is most indicative of renal failure? The correct answer is option A, elevated creatinine. Question number 8. Which position is best for a patient experiencing difficulty breathing? The correct answer is option C, high Fowler's. Question number 9. Which medication classification is primarily used to reduce inflammation? The correct answer is option B, corticosteroids. Question number 10. What nursing intervention is essential for preventing pressure ulcers? The correct answer is option A, frequent repositioning. Question number 11. Which diagnostic test confirm the presence of deep vein thrombosis? The correct answer is option A, Doppler ultrasound. Question number 12. What is the first action when a patient develops a sudden shortness of breath? The correct answer is option A, assess airway and breathing. Question number 13. Which symptom is most characteristic of a hypoglycemia? The correct answer is option A, sweating. Question number 14. Which nursing assessment is priority for a patient with suspected stroke? The correct answer is option A, neurological status. Question number 15. Which action is most important when a patient is having a seizure? The correct answer is option A, protect the patient from injury. Question number 16. What is the most effective method to prevent the spread of infection? The correct answer is option A, hand hygiene. Question number 17. Which laboratory value indicates anemia? The correct answer is option A, low hemoglobin. Question number 18. Which position is preferred for a patient after abdominal surgery to reduce strain on the incision? The correct answer is option A, semi-Fowler's. Question number 19. Which symptom indicates fluid overload in a patient with heart failure? The correct answer is option A, peripheral edema. Question number 20. Which nursing action is most important when administering blood transfusion? The correct answer is option A, verify patient identity and blood type. Question number 21. Which symptom is most indicative of hypokalemia? The correct answer is option C, muscle weakness. Question number 22. What is the priority nursing action when a patient develops anaphylaxis? The correct answer is option D. Administer epinephrine. Question number 23. Which laboratory test is used to monitor warfarin therapy? The correct answer is option C. INR. Question number 24. What assessment finding indicates increased intracranial pressure? The correct answer is option A. Projectile vomiting. Question number 25. Which action should the nurse take first for a patient with suspected myocardial infarction? The correct answer is option B. Administer oxygen. Question number 26. Which intervention is most important for a patient with acute asthma attack? The correct answer is option B. Administer short-acting bronchodilator. Question number 27. What is the best method to prevent catheter-associated urinary tract infections? The correct answer is option B. Maintain aseptic technique during insertion. Question number 28. Which sign is most specific for meningitis? The correct answer is option C. Neck stiffness. Question number 29. Which nursing action is priority when a patient has a nasogastric tube with sudden drainage of bright red blood? The correct answer is option B. Notify the physician immediately. Question number 30. What is the earliest sign of a dehydration in an adult patient? The correct answer is option B. Dry mucous membrane. Question number 31. Which assessment finding indicates hyperthyroidism? The correct answer is option C. Tachycardia. Question number 32. What is the most important nursing intervention for a patient receiving chemotherapy? The correct answer is option B. Monitor for infection. Question number 33. Which symptom is most characteristic of Cushing's syndrome? The correct answer is option B. Moon face. Question number 34. What is the first action when a patient develops hypoglycemia? The correct answer is option B. Administer 15 to 20 gram of fast-acting carbohydrate. Question number 35. Which position should a patient with a gastrostomy tube be placed during feeding? The correct answer is option C. High powders. Question number 36. Which sign indicates early shock in a patient? The correct answer is option A. Tachycardia. Question number 37. Which intervention is most important to prevent post-operative pneumonia? The correct answer is option B. Encourage deep breathing and coughing. Question number 38. What laboratory value indicates hypocalcemia? The correct answer is option B. Serum calcium 8.5 mg per deciliter. Question number 39. Which action should the nurse take first for a patient with severe anaphylaxis? The correct answer is option D. Administer epinephrine IM. Question number 40. Which symptom is most indicative of hypovolemic shock? The correct answer is option A. Rapid weak pulse. Question number 41. Which symptom is most characteristic of hyperglycemia? The correct answer is option B. Polyuria. Question number 42. What is the first nursing action when a patient experiences chest pain? The correct answer is option B. Administer oxygen. Question number 43. Which sign indicates fluid overload in a patient with heart failure? The correct answer is option B, peripheral edema. Question number 44. What laboratory test is used to diagnose anemia? The correct answer is option D, hemoglobin. Question number 45. Which nursing intervention is most important to prevent falls in elderly patients? The correct answer is option D, use of non-slip footwear. Question number 46. Which symptom is most indicative of hypocalcemia? The correct answer is option B, Trousseau's sign. Question number 47. Which nursing action is priority for a patient with severe asthma attack? The correct answer is option D, administer short-acting bronchodilator. Question number 48. What is the most important nursing intervention for a patient with nasogastric tube feeding? The correct answer is option D, cheek tube placement before feeding. Question number 49. Which symptom indicates early hypovolemic shock? The correct answer is option D, tachycardia. Question number 50. Which laboratory value indicates a renal failure? The correct answer is option C, elevated creatinine. Question number 51. Which intervention is priority for a patient with acute myocardial infarction? The correct answer is option C, administer oxygen. Question number 52. Which symptom is most characteristic of hypothyroidism? The correct answer is option A, cold intolerance. Question number 53. Which action is most important for preventing post-operative infection? The correct answer is option B, maintain aseptic technique. Question number 54. Which symptom is most indicative of right-sided heart failure? The correct answer is option B, peripheral edema. Question number 55. Which nursing intervention is essential to prevent pressure ulcer? The correct answer is option B, frequent repositioning. Question number 56. Which sign is most indicative of hypoglycemia? The correct answer is option A, tremors. Question number 57. Which laboratory test is most specific for diagnosing diabetes mellitus? The correct answer is option B, fasting blood glucose. Question number 58. Which intervention is most important to prevent deep vein thrombosis in immobile patients? The correct answer is option B, leg exercises. Question number 59. Which position is best for a patient with difficulty breathing due to COPD? The correct answer is option B, high fowlers. Question number 60. Which action should the nurse take first for a patient experiencing an acute seizure? The correct answer is option B, protect the patient from injury.